Dr. Jon LaPook is our chief medical correspondent. Good evening, John.
Good evening.
So what do you think has happened to Secretary Clinton?
Rebecca, that blood clot that Margaret described is behind the right ear, and it's in the vein that helps drain blood from the brain all the way down. And what happened is really anybody's guess, but trying to put it together, we know that 2 to 3 weeks ago, she fainted and hit her head. Now at that time, she could have had trauma. She could have ripped that vein and had a little bleeding, a little clot formation. On top of that, we were told she had a stomach virus, and we know that dehydration increases the odds of having a clot. On top of that, there's this history of a blood clot in her leg, and it is possible that she has an underlying tendency towards increased clotting. That's something down the road where doctors are going to have to look into that.
So how serious does it sound, and what's the prognosis?
The prognosis seems excellent, and the reason is this was found incidentally. She didn't have any symptoms, she didn't have a stroke, she didn't have a seizure. It was just found on an incidental exam. Now, she's going to need, say, 3 to 6 months of anticoagulation. They're going to have to look at her very closely because in the months following head trauma, if you're thinning somebody's blood, there is a risk of causing bleeding. So they're going to follow her very closely, and the prognosis should be excellent.
Dr. Jon LaPook, thank you.